Hello, my name's Andy Watts. My supervisor's name is Kerry Green, and this is my ACMGAS206A Prac. So I've just seen this dog cross the road. I assume it's been hit by a car. Before I react and run out onto the road and get hit myself, I should check for danger. So no cars, well, there is a car coming, so we'll wait. I don't really know what's happened here, but judging from the fact that I see no other obvious causes of injury, I'll assume this dog has been hit. So we'll cross the road, we'll approach the dog slowly, calmly, quietly. Before I rush toward the animal, I need to make sure I've got the equipment prepared. I've got a slip lead and a towel, some bandaging that I grabbed from my boot so I can assess the animal's stability. And then I must secure it so it doesn't flee from me and injure itself further or escape so I can't treat it anymore. So I'll just approach slowly. It's got a collar on that's good. I'm just going to attach this. So I've got the lead attached, so it's around my wrist. There's no risk of this animal fleeing now. The dog's panting quite heavily. The breathing sounds okay. It's not laboured, but it's pretty stressed. As this is an emergency situation, I don't have extensive medical equipment. I can normally find a pulse just inside the back leg, so I'll check it. I don't want to move this leg, obviously, so I'll just check the pulse. And I count the beats in 15 seconds, times it by 4. So this heartbeat is pretty rapid. It's about 160 beats per minute. I want to give the dog a bit more of a physical check over, so I'll have to relocate it to the surgery pretty soon. I want to make sure I'm not exacerbating any fractures by lifting it incorrectly and making anything worse. So I want to put a little muzzle on this dog. I'm worried that it'll react out of pain and not mean to. So I can make a makeshift muzzle because I don't have everything here. So what I can do is lightly over here, cross it over underneath the chin and tie it loosely around the back of the neck. Not too tight because this dog is panting. Just like that. So we've got the dog secured, so I'm not at risk of getting bitten. So now I just check gently over the dog and feel for any abnormalities, any pain, anywhere the dog's reacting, or any protruding bones or lacerations. So you can check the eyes, they're alert. The gums are a little bit pale. This dog's been injured and pretty stressed. It's bleeding here from the leg. I'm not sure about what's under the surface, but I can see there's a pretty bad fracture here. It's off at an angle, and there's broken skin here. So I'm going to buzz my supervisor in the office to come out and give me a hand because it's quite a large dog. I need help lifting it. So when she comes out, we'll evaluate the situation, whether we make a little sling and carry the dog in the towel, or whether we lift it together, where I would lift the front and she would lift the back. We'd have to be really careful not to make this break and any other breaks that we can't see any worse. If the bleeding was really bad, I would have to bandage it. Normally with bandaging a wound, we'd apply a disinfectant first and then a clean gauze. In a situation like this, if it was bleeding really bad, I'd apply pressure and take the dog straight inside. So I'll buzz my supervisor now and we'll get this dog treated.